So I think the thing that I and a lot of other people find frustrating about PCOS is that the diagnosis really doesn't even do all that much for you. Like, it's great to have answers of why you're experiencing the symptoms you're experiencing, but then it's kind of like, okay, so what's next? Like, how do I fix this? I really didn't talk to that many people about it. I kind of went to the gynecologist every year. They put me on birth control, which helped manage some of my symptoms. That was kind of all I got. And then when I was turning 30, I started to really think a lot more about my health and my fertility. I felt like if I knew I was gonna have issues with it, I wanted to kind of get on top of it and get ahead of it. So I started to do some research. So I distinctly remember it was in the middle of COVID. I was on my computer trying to Google PCOS things on Reddit, and just felt like if this is the best that healthcare has to offer us for the millions of women with PCOS, we have a major problem. So that was really the impetus to start Allara. Through Allara, I've been able to not only work with a doctor, also have been doing a ton of testing for fertility. As I said, I just want to make sure I'm prepared and kind of know my options. And I've been working with my Allara doctor to test a lot of my hormone levels, retest them at different points in my cycle and over a few months, just kind of see how things change. And I've also had a lot of conversations with them about egg freezing and kind of when that makes sense. I'm actually going through the egg freezing process literally this week. I'm happy to share more about that if anybody's interested and kind of give you a recap. So that's something that's been really helpful to talk through for me. Other thing I've been able to do is talk to my nutritionist about how I can make diet and lifestyle changes, which is something that I had never had access to before. It just didn't occur to me. And for me, that's been a really helpful part of things. So let me know if you want me to chat more about anything we talked about over this lunch. Thanks, guys.